Martin Wilkinson is a Windhoek resident who has been posting about the possible dangers of inhaling the smoke from the Katutura Hospital's incinerator for years. He has previously worked as a hospital maintenance officer in the Zambezi and Kavango regions.
I know about the pollutants in the medical waste. I know about the pollutants in the plastics. I know the problems that they can cause, respiratory problems, cancer, fetal development problems. It's just a disgusting thing to see every single morning, and it stays in a very thick, heavy line across Katutura. And if you're downwind of it, you could literally catch ash in your hand. I've done that before.
Namibia's Environmental Management Act classifies incinerating as an activity that should not be undertaken without an environmental impact assessment. The Ministry of Environment, Forestry and Tourism confirmed that the Ministry of Health and Social Services has not been in compliance with the law.
In 2018 already, we had issued a compliance order to the Ministry of Health and Social Services because of the condition of these incinerators, and also considering the fact that such incinerators countrywide do not have environmental impact assessment in place. So the compliance order that we issued to the ministry was basically to say that they should have environmental management plans in place for all the incinerators they have.
The Katutura Hospital's incinerator is not the only one operating at an unacceptable standard. There are many other government hospitals and clinics countrywide with the same problem. This is the incinerator at the Oshakati State Hospital, billowing the same black smoke. Muyunda says untreated hospital waste is still being disposed of in landfills in some parts of the country, affecting underground water sources.
The dangers is that the emissions that come from there, some of them can be hazardous, and also the fact that medical waste that is disposed in landfills have potential to contaminate the environment, our water sources. It has potential to really spread diseases that are dangerous and to human beings, but also to our animals.
The Environmental Management Act states that no one may carry out a listed activity without an environmental clearance certificate. Failure to comply is a crime, and the penalty is $500,000 or imprisonment for up to 25 years or both. Failure to obey a compliance order is also a serious crime, and the same penalties apply. When the NBC approached the Ministry of Health and Social Services for a response, all efforts to secure an interview were unsuccessful. Francis Shahama, NBC News, Windhoek.